Good morning. Good morning and welcome back. This time we're here as the 2014 Congressional Black Caucus Spring Health Brain Trust. And I hope you've had time to grab your breakfast because we have a lot of ground to cover. And that's why I'm starting right on time today. It's good to see so many of you up and early and with us. I don't see Mr. Al Nuruddin today, but the other reason I'm starting on time is because he usually has a lot of questions, and I missed his presentation yesterday, so I'm sure I'm going to have to give him some extra time. For those of you who were here yesterday, I think you'll agree with me when I say that yesterday was really amazing. All to the credit of Dr. Puckrein and his team, of course, who you'll hear from in a few minutes, but also to all of the fantastic speakers and moderators who took time to be with us yesterday, to share their perspectives, their experiences, and expertise on a range of topics that are also vitally important to the health disparity elimination effort and to health equity. And I'm sure we all left here yesterday informed, inspired, and energized. I also want to give a very heartfelt thanks to today's special partners, all of whom who have been with us through thick and thin. Some like Centene, who crossed the United States with us as we tried to prepare our communities for the Affordable Care Act, or Darren Parks from DaVita, or another good friend, Pete Norman from Alchemies. I would be also very remiss if I didn't especially acknowledge Joyce Larkin and the rest of the team from Centene Corporation, not only for her and their support of this event, but for our many years of working together to effectively promote health equity. Is Joyce here yet? She's probably on her way. But I really wanted to give her a special recognition and special thank you. Like yesterday, we have a very ambitious agenda set for you. When my staff and I are exploring what we might do and what we might address in a Spring Health Brain Trust, it's always difficult because we have so many issues that challenge our communities. But I would say it wasn't that difficult this time because we do have the Patient Protection and Affordable Care Act, and we've made great strides under this landmark law. So there's still a lot that we need to talk about the Affordable Care Act, a lot that needs to be said about this landmark legislation. We have had undeniable successes. You've heard about some of them yesterday in transformative changes, and they're all taking place in our nation's healthcare system. And I'm not going to list all of those provisions. You heard about some of them yesterday. You'll hear about more of them today. But as I said yesterday, each of you, in your varied and wonderful capacities, have helped hold a hard line on all things health equity related in the Affordable Care Act. For that, there are just not enough thank yous to all of you. Please know that, and for anyone who feels that your efforts have gone unappreciated, let's do what we did yesterday. Give yourselves a round of applause. However, I think it's safe to say, and especially from a health equity perspective, that despite our progress, we have so many more issues to address and so many more steps that we should and must take. And for that reason, and so many of those issues, many of those steps that we must take, they're at the front and center of today's agenda. Setting the stage, defining the landscape, and creating the context in no uncertain terms for us this morning is a special presentation by Dr. Arthur James, the Associate Clinical Professor at The Ohio State University. We are going to do some follow-up on Economist Dana's presentation, continuing to look at healthcare issues in our committed community. And I made reference yesterday to the unique challenges of our underfunded and under-resourced and under-attended to territories, and I would be remiss if I didn't continue to inform everyone of our plight, especially in the case of the Affordable Care Act, exchange, and Medicaid expansion. If the Virgin Islands Senator Clarence Payne is here, I'd like to recognize him. He'll be joining us later. During the luncheon, we do have a small last-minute change. Mr. Raymond Jetson, who is printed on the agenda, is unable to join us, but we have our other keynote presenters, Daniel Dawes, Dr. Garth Graham, and Dr. Brian Smedley, all of whom are very well known, have been partners with us for many, many years. They'll be here, and they are going to share a new effort that they'll be launching. Following their presentation, we're going to honor 3 individuals with the 2014 CBC Spring Health Brain Trust Awards. And so, as you looked at today's agenda, I'm sure you've noticed that as my swan song, it's one that reflects many of my special interests. And after the Virgin Islands and the territories, my first interest, I'm very concerned about the challenges that our health professionals are facing. So after lunch, we're going to hear from a panel entitled Saving Our African American Health Providers. And although the focus is on doctors and other providers, it's really about all of us. And so I hope that everyone will stay to hear what they'll be sharing. As I said, we have a packed agenda, and we want to make sure we have time to hear from you today. So we're going to get started. I'm going to hand the microphone to two individuals, two great friends and colleagues, without whom the Health Braintrust could not have accomplished as much as we have. Dr. Gary Puckrein, our president and CEO of the National Minority Quality Forum, and thank you again, Gary, for a great day yesterday. And Ms. Shuanise Washington, the president and chief executive officer of the Congressional Black Caucus Foundation, who will deliver greetings. We've been blessed to have both of them as valued partners for many, many years. Following Ms. Washington, you'll hear from Deborah Frazier, a panelist this afternoon, but she's also the Chief Executive Officer of the National Healthy Start Association, and she'll introduce her friend and colleague and our keynote speaker, Dr. Arthur James. So, Dr. Puckrein, would you come and bring greetings? Give him a round.
Thank you so much. You know, I, again, always feel like we've been on quite a journey, and obviously the world never stands still. So it's always, you know, I'm thinking about this was going to be our last time at this particular moment, and so it has really been thought-provoking. I'm just going to make some really quick remarks. Certainly, before doing so, I want to also thank the partnership with the Congressional Black Caucus Foundation. That too has been part of the magic of the two-day event that we've had over the last 8 years. It's hard to imagine. 8 years ago, we started all this. I just simply want to remind you about the clinical trial project I'm in. For those who weren't here with us yesterday, we established a industry-wide partnership through PhRMA, the Trade Association for the Pharmaceutical Industry, in which they've made a pledge to work with us to eliminate, better put, to increase minority representation in clinical trials. It's an important business, and that business is about not just looking at getting new drugs and therapies and are they safe and efficacious in minority populations, which is actually pretty important. I think for those, again, who were here yesterday and heard Dr. Kim's presentation around atrial fibrillation and the use of warfarin, understand that there are variations in population that we need to know and understand. And so it's very important that minority populations participate in clinical trials because you can't even begin to eliminate health disparities if medicine is not safe and efficacious for everyone. But also what clinical trials do is they provide the foundation for clinical guidelines for the management of disease so that when you go to your doctor, he's looking at standards of care to provide you. And historically, what's happened with minority populations, because they weren't in the trial, we relied on clinical practice, what actually happened in practice when you gave these medicines to minority populations. But you should understand that even there, we didn't have the databases so that all physicians could kind of call on clinical practice to understand how these medicines were working in minority population. And so by participating in clinical trials, you're also informing clinical guidelines. And one of the magics of Washington that I guess we all in some way or another have to put up with, those clinical guidelines inform performance measures. Performance measures is the way in which providers get reimbursed. So when you go to your doctor, he's actually adhering to clinical guidelines and performance measures that inform how insurance companies, government, as well as the private sector, reimburse him. So if you go all the way back down the trail here, if the underlying science is not strongly, in terms of science, is not strong, it means the guidelines are not strong, it means the performance measures are not strong, and so the provider is being reimbursed to provide you care that may not be the best care for you. And the only way to correct that whole trail is you got to start with good science. And that's the challenge of minority populations. And I, talked about a little bit yesterday about, Tuskegee, that was 1940, it ain't 2014, ain't nothing I can do about it, nothing you can do about it. It's time to get on with it because we're hurting ourselves now. We sometimes, I want to tell this quick story because I think it's important. There's a book called Dear Master, and you have to go read it. It's published a while ago. These were slaves in Alabama, and their master lived in Virginia, and there were no whites on the plantation. And the book is a series of letters that are written by the slaves to their masters, and they're sort of complaining about each other's behavior and the lack of productivity. And you sit there and you read the book and you say to yourself, so why did you walk away? I mean, just leave, I mean, it was like there were no walls, there were no chains there. But sometimes mind create the chains for you. And that's what I'm saying here, that if you dwell on Tuskegee and the past, you're creating a set of chains that are inhibiting the future. And so the future is really about getting good science, good information, so that we can inform the kinds of care that going forward for minority populations. So there's a desk out there with brochures and information. There's a website that would ask you to go to. We need your help in order to make sure that we're recruiting minorities into clinical trials. And I think that's the challenge that I'd leave you with this morning. So thank you very much, and looking forward to a great day.
Good morning, everyone, and welcome to the 2014 Spring Conference of the Congressional Black Caucus Health Braintrust. I bring you greetings on behalf of my colleagues at the Congressional Black Caucus Foundation. We are pleased to host this Health Disparities once again with Dr. Gary Puckrein and his staff at the National Minority Quality Forum, and we thank them for their partnership and outstanding work. And we're also pleased to have worked once again with Delegate Christensen, her staff, as well as her colleagues at the Congressional Black Caucus. I also want to take a moment to thank the speakers for sharing valuable information and their expertise at this summit, and everyone who has joined us today for this important discussion. It is an honor to be here with so many committed professionals who share the Foundation's concern about the health and safety of the American people. As you are well aware, health disparities continue to have a detrimental impact on our society. These disparities are evident along racial, ethnic, income, and geographic lines. Health disparities affect the health status, health outcomes, and health care access of communities across our nation. Our understanding of what influences health has expanded remarkably. Today, national attention is more focused on the role of social factors in shaping the public's health. Leaders in companies, government agencies, and community organizations are working individually and collectively to define solutions in their settings and beyond. And of course, elected officials at all levels continue to define and debate policy solutions to health and healthcare crisis. The increase in federal attention to social detriments of health and comprehensive health policy approaches is certainly attributable to the efforts of Delegate Donna M. Christensen. During the 17 years she's been in Congress, Dr. Christensen has worked diligently to show that people's environment impacts their health, their social status affects their access to care, and their health implications in all public policy. For that, We applaud her and we thank her. And personally, I would also like to thank Delegate Christensen for her steadfast support of the Congressional Black Caucus Foundation. She's not only a member of our board of directors, but through our Leadership Institute for Public Service Fellows programs, we have provided more than 150 rising African American leaders with the opportunity to experience and shape public policy on the national level. And the Louis Stokes Health Policy Fellows Program, in particular, has benefited greatly from Delegate Christensen's involvement and expertise since its inception 10 years ago. Many of our fellows were privileged to have worked in Delegate Christensen's office as part of their fellowship. In addition to the Stokes Fellowship, the Foundation Scholarships programs also help to expand opportunities for future leaders. The CBCF General Mills Health Scholarship and the Louis Stokes Health Scholars Program, sponsored by United Health Foundation, offer financial support to students across the country who are committed to addressing health disparities through effective practice or policy. CBCF is also one of the 19 organizations that form the Act Against AIDS Leadership Initiative. Through this initiative, we work with individuals individually and collectively to elevate the visibility of HIV/AIDS among African Americans and Latinos. Collectively, we aim to intensify education and prevention efforts in these communities, and at the same time, we strive for better access to needed services and greater social acceptance for those living with HIV and AIDS. As the title of this year's conference indicates, there has been notable progress towards achieving health equity, but there is still much work to be done. I wish you all the very best in your discussions and deliberations at this important summit, and I am confident that your work and our partnership will make a difference. Do enjoy the rest of the day and the conference. Thank you very much.
Okay, thank you. I know she just stepped out, but I wanted to just, before Ms. Frazier comes up, to recognize Delegate Shirley Nathan Pulliam, who was here with us yesterday. She's here again today, and one of the next state senators of Maryland.